Nimesulide is a painkiller and fever-reducing medicine that was widely used in India for many years. It belongs to the group of drugs called non-steroidal anti-inflammatory drugs or NSAIDs. Doctors prescribed it for fever, body pain, dental pain and inflammation. But today Nimesulide is banned for use in children in India and its safety has been questioned worldwide. So why was this drug restricted? Is it completely banned and what made it controversial? Let's break it down. First, we need to understand how Nimesulide works. Nimesulide is a preferential COX-2 inhibitor, which means it reduces pain and fever by blocking inflammatory chemicals called prostaglandins. Because of this, it was considered effective and fast-acting compared to some older NSAIDs. However, the major concern with Nimesulide was liver toxicity. Multiple reports from different countries showed cases of drug-induced liver injury, also known as hepatotoxicity, in patients taking Nimesulide. Some of these cases were severe and led to liver failure. In rare but serious situations, patients required liver transplantation and a few deaths were also reported. This raised a major red flag for drug regulators. Countries like the United States, United Kingdom, Canada, and Australia never approved Nimesulide for use because of safety concerns. Later, several European countries either banned it or strictly restricted its use. Now let's focus on India. In India, Nimesulide became extremely popular, especially as a fever medicine for children. Pediatric formulations were widely available and many parents used it without strict medical supervision. But children are more vulnerable to liver toxicity because their metabolic systems are still developing. Reports began to emerge of serious liver damage in children associated with Nimesulide use. This prompted the Indian regulatory authorities to review the safety data. After evaluating the risk, the Government of India banned the use of Nimesulide in children below 12 years of age. This decision was taken to prevent further cases of drug-induced liver injury in the pediatric population. So it is important to clarify, Nimesulide is not completely banned in India. It is banned for use in children, but it is still allowed in adults under prescription, although many doctors prefer safer alternatives. Now the next question is, why is liver toxicity such a big concern? The liver is responsible for metabolizing drugs. Some drugs produce toxic metabolites that can damage liver cells. In the case of Nimesulide, certain metabolic pathways were suspected to cause oxidative stress and mitochondrial injury in liver cells. This can lead to elevated liver enzymes, jaundice, acute hepatitis, liver failure, and in severe cases, death. The problem is that this reaction is idiosyncratic, meaning it is unpredictable. It does not occur in every patient and cannot always be prevented by adjusting the dose. That makes it particularly dangerous. Another issue was over-the-counter misuse. In many areas, Nimesulide was easily available without prescription. It was often used for simple fever where safer drugs like paracetamol would have been sufficient. This unnecessary exposure increased the risk of adverse effects. When regulators evaluate a drug, they look at something called the risk-benefit ratio. If a drug provides unique benefits that outweigh the risks, it may be allowed with restrictions. But if safer alternatives are available, a drug with serious side effects becomes less acceptable. For fever and mild pain, we already have safer options like paracetamol, ibuprofen. These drugs have a much better safety profile when used correctly. So the benefit of Nimesulide did not justify the risk, especially in children. Another important factor was global regulatory pressure. Since many countries had already banned or restricted Nimesulide, Indian authorities faced increasing scientific and public health concerns about continuing pediatric use. Medical associations and pediatricians also raised safety warnings. All these factors led to the decision to restrict Nimesulide use in children. Today, most pediatric guidelines in India recommend paracetamol as the first-line drug for fever. For adults, Nimesulide may still be prescribed for short-term use in specific cases, but it is generally not the first choice. Doctors are advised to use the lowest effective dose, avoid long-term use, monitor liver function if needed. Avoid use in patients with liver disease. So the key takeaway is this. Nimesulide was not banned because it was ineffective. It was restricted because it carried a risk of serious liver damage, especially in children, and safer alternatives were available. Drug safety is not only about how well a medicine works, it is also about how safe it is for the population. Even a rare but severe side effect can lead to restriction if the drug is widely used.